I think it gives physicians, additional opportunities, because what we hope to do with these mergers is offer more specialized care closer to home. So, as an example, Palisades is located in Hudson County. Many patients, typically from that area, would seek specialty care in New York, and we're hoping to offer a lot of that specialty care closer to home. So I think it gives physicians and patients really better access to care. Same principle with Meridian. As it allows us to grow and offer more accessible care, those opportunities are presented to physicians. So we have many physicians that partner with us. Some are employed, some are partners, some join our accountable care organization. As we grow bigger as a system, there's just going to be that many more opportunities for physicians to really partner with us. And ultimately, it not only benefits the doctor, but it will benefit their patients as well. You always want to balance, your growth goals with making sure you provide the best quality care. The answer to your question is I'm not concerned about it. I think that what Meridian and Hackensack offer now are some unique things that will complement one another. So, as an example, Hackensack has been well known for just tremendous quality outcomes and great results. We've been recognized as an example by U.S. News and World Report as being number one in New Jersey, one of the top hospitals in the nation for several years. So we're bringing a pretty robust quality infrastructure along with a robust academic and research infrastructure to Meridian. Meridian, what they bring to us is they've had a very comprehensive continuum of care. So they have a lot of post-acute care services, they have nursing home beds, they have rehabilitation beds, they have many ambulatory care centers out there. So that type of continuum is something that Hackensack needs. So each side's bringing something else to the table, and who's the winner from all that? Honestly, physicians and patients. I think what the Affordable Care Act, one of the impacts of the Affordable Care Act has been, and other changes in the healthcare system, is that there's a lot more consolidation going on in the industry. I don't know that every independent community hospital has to become part of a larger system, but I think it's certainly helpful, and if they're not ready to become fully part of a system, certainly some sort of an affiliation or partnership is always welcome. And matter of fact, we at Hackensack have a partnership with CentraState right now, where we're helping them build their cancer services, their oncology services, and they are in turn using some of our specialty oncology up here at Hackensack. We recognize that traditionally providers and insurers were kind of they were going at it. They were not necessarily synergistic, but we realized as part of our health network strategy that we wanted to partner with insurers, because we believe that if we share risk with insurers to provide value to healthcare consumers, that it's the right approach. And when Horizon announced that they were offering this Omnia product, which is a tiered network product, we believe that it would provide value to the healthcare community, whether it's individuals seeking that type of insurance plan, or even employers and small and large employers that would be seeking that type of a plan. It saves individuals and employers on premium costs, on out-of-pocket costs, and we believe that it incentivizes hospitals like Hackensack to really be patient-centered and to focus on the best possible value and quality that we can provide. So we thought it was a very worthwhile endeavor to partner with Horizon. The other thing is we did our research. I mean, these tiered networks are all over the country. I mean, the Horizon Omnia product is certainly by no means the first or the only one. Matter of fact, in New Jersey, there are several that have been on the market for many years. This one's gotten a little bit more publicity because it's a large insurer, but it really does make sense, these types of partnerships between hospitals, health systems, and insurers, and we're looking forward to working with Horizon to make Omnia a real success. I wouldn't even call it the future. I would call it the current. It's because, again, it's pretty prevalent in many states around the nation. These types of partnerships, these tiered networks, because they are creating value. They're saving people money on their premiums. For the most part, we can monitor the quality of care has certainly been enhanced, and the patient experience has also been enhanced as a result of that focus on the patient and their families. So I consider it the current and the future. Some health systems have actually gone as far as to start their own health plans. But certainly, I think a partnership model like this is something that can benefit the entire community. I think it's a little bit of growth. I mean, I think there's some of the concerns that have been raised in the press have to do with how the criteria was set as to which providers become considered a tier 1 or which providers are considered a tier 2, and I think some of that probably shakes out over time, and as more information comes out about it. From our perspective, I can't really comment on criteria that an insurance company uses, but from our perspective, we're happy to partner because we believe we have a comprehensive healthcare system that really is very suitable toward this type of partnership to really create that healthcare value to all of the communities that we serve.